What is polycystic ovary syndrome, PCOS, or polycystic ovarian disease, PCOD? Polycystic ovarian syndrome or disease, PCOS/PCOD, is a hormonal disorder that affects women in their reproductive age. PCOS is a common health condition that affects teen and young women. It is seen in 1 out of 10 women in their childbearing age. The reproductive system of women is controlled by the complex interplay of primarily 5 reproductive hormones, namely estrogen, gonadotropin-releasing hormone, follicle-stimulating hormone, progesterone, and luteinizing hormone. An imbalance within these hormones leads to a hormonal disorder called the polycystic ovary syndrome, PCOS, or polycystic ovarian disease, PCOD, among women of reproductive age. What is PCOD or PCOS? What is polycystic ovary syndrome? Polycystic ovarian syndrome is marked by the breakdown of reproductive hormones in women of childbearing age. Along with havoc in female hormonal control, ovaries release abnormal amounts of androgen, male hormones. This hormonal breakdown results in irregular or prolonged menstrual periods, excessive body hair, acne, and hair loss. Polycystic ovaries may fail to develop follicles and regularly release eggs, causing difficulty in conceiving a pregnancy. What are the causes of PCOS or PCOD? There are no certain causes of PCOS, however the contributing factors include excess androgen. Overproduction of androgen by ovaries causes may lead to hirsutism and acne. Excess production of insulin. Insulin hormone controls the blood sugar levels in human body. When human cells become resistant to the action of insulin, the blood sugar level increases. As a result, the body produces an excess of insulin to control this increased blood sugar level. An excessive insulin production in turn increases the production of androgens, which are the male hormones, otherwise very less in females. Increased androgen production causes difficulty with ovulation. Heredity. Certain genetic correlation may exist with PCOS in women. Presence of low-grade inflammation. Women with PCOS experience a low-grade inflammation that may stimulate polycystic ovaries to produce androgens. What are the signs and symptoms of PCOS or PCOD? Some women start experiencing symptoms around the time of their first period. Signs and symptoms of PCOS may vary, however, the symptoms are generally more severe in obese patients. Some of the commonly reported signs and symptoms of PCOS include acne, darkening of skin, hirsutism, abnormal growth of hair on face and body, irregular menstrual cycle, polycystic ovaries. Sometimes both ovaries may be involved, that is bilateral polycystic ovaries or ovarian cysts, skin tags, thinning hair, weight gain. Signs and symptoms of PCOS or PCOD. Another gynecological condition called endometriosis may have similar symptoms, or the two may coexist. What are the possible complications of PCOS or PCOD? Some of the possible complications of PCOS are abnormal uterine bleeding, psychological disorders like depression and eating disorders, endometrial cancer, pregnancy-induced or gestational diabetes and/or hypertension, infertility, metabolic syndrome, miscarriage or premature birth, non-alcoholic steatohepatitis, sleep apnea. How is PCOS or PCOD diagnosed? Your gynecologist may be able to diagnose PCOS on the basis of medical history. To get detailed information about menstrual periods and weight changes, presence of at least 2 of the following symptoms is indicative of PCOS. Irregular periods. Signs of high levels of androgens. Hirsutism. Acne. Thinning of scalp hair. Higher blood levels of androgens. Polycystic ovaries. Physical examination. Pelvic exam to assess the reproductive organs for masses, growths or other abnormalities. Tests. Blood, glucose tolerance, cholesterol and triglyceride levels, etc.